My name is Katina, and I will be performing my medication administration checkoff. I am a student nurse at the University of South Alabama. I will start off by closing the medication room door, and I will not have any contact with my colleagues, nor will I use the phone. I will also be mindful of the no interruption zone per the agency policy. And I will start off by comparing the MAR to the patient's order. MAR, patient order, Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963. Chart number is 417-6352, 417-6352. The MAR states he is allergic to penicillin, and the patient order also states that he is allergic to penicillin. The order is for morphine sulfate IM, 5 milligrams IM every 4 hours as needed for pain. Morphine sulfate, 5 milligrams IM every 4 hours as needed for pain. It has been 4 hours since his last dose, so it is time for another dose. Now we'll perform hand hygiene. I will get the right medication from the drawer. Morphine sulfate, 10 milligrams per 1 milliliter, 12/20/25 is the expiration date, so it is still in date. I will get a 3 milliliter syringe, blunt tip cannula, and 23 gauge needle. I'll use an alcohol swab to clean the vial. Now I will connect the cannula. The order is for 5 milligrams IM every 4 hours as needed for pain. Available is 10 milligrams of morphine sulfate per 1 milliliter. Therefore, I will need half a milliliter. I will pour down half a milliliter of air. And push that in the vial and withdraw half a milliliter, making sure there are no air bubbles. Now I will recap the cannula using the scoop method. I will remove the cannula and put it in the sharps container. Now I will put the 23 gauge needle on, and I will check again for the medication. Morphine sulfate, 5 milligrams IM every 4 hours as needed for pain. I need half a milliliter. Half a milliliter is what is in the syringe. Now, I will make sure I have the right patient and right medication again. The order is for morphine sulfate, 5 milligrams, IM, every 4 hours as needed for pain. For Mr. Jaguar J. Jones. Jaguar J. Jones. Morphine sulfate. 5 milligrams. IM every 4 hours. PRN pain. Date of birth 8/25/1963. Now we'll put that on the syringe. Confirm again just to make sure. Morphine sulfate, 5 milligrams every 4 hours as needed for pain. For Mr. Jaguar Jones, morphine sulfate, 5 milligrams IM every 4 hours as needed for pain. Now I will go to my patient's room and administer the medication. Hey, Mr. Jones, or hey, my name is Katina. I am a nurse at the University of South Alabama, and I will be administering your morphine for pain. Can you tell me your name, date of birth? And I would also check Jaguar J. Jones, Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963. Chart number is 4176352, 4176352. Mr. Jones, I see that you are allergic to penicillin. Do you have any other allergies? No other allergies. All right, good deal. So, Mr. Jones, I'm here to give you your morphine for pain. How are you feeling? I would hand hygiene, don my gloves. I would raise the bed to a comfortable working height. Let down the side rail. Since this is an IM injection, I would give it in the dentrogludal, and I would start by wiping with an alcohol swab. Circular motions from the center outward. Being sure not to wipe the same spot twice. I would confirm again. Right patient, Mr. Jaguar J. Jones. Jaguar J. Jones. 8/25/1963, 8/25/1963. Chart number 4176352, 4176352. And I would confirm medication again, right medication. Morphine sulfate 5 milligrams. IM every 4 hours as needed for pain. It has been 4 hours and it is indicated for pain. Therefore, he is getting his medication. So I'll locate the right injection area. Pull the skin back tight. Go in deep. All right, Mr. Jones, big stick. Then I would aspirate for blood. No blood. Then I would inject. Then put the needle in the sharps container. Then I would lower the bed to the lowest setting. Let the side rail up. Assess the patient. Come back in 30 minutes and assess the patient again. I would hand hygiene before walking out. And when I got to the desk, I would note in the chart that I gave the patient his medication, the time I gave it, the amount, how he was feeling, the assessment. And I would note how he reacted to the injection. That is all.